Okay, level 1 in the taxonomy, remembering. So most basic level involves recall of facts and previously learned information. Um, at this level, students demonstrate their ability to retrieve knowledge from memory that they should have learned. And the key verbs you might use in these kind of objectives would be like define, identify, list, name, recall. Um, these kind of verbs, um, which are just basic recall. So, for example, um, identify signs and symptoms of diabetes. It's not application, it's not analyzing anything, just what are the signs and symptoms, basic recall. Level 2 understanding. So at this level, students should translate knowledge into new forms, interpret the information, um, look at consequences from these ideas. Assessment strategies for this level might include asking students to describe a process, differentiate between concepts, or explain significant clinical findings. So it's just the next level up. These are really important levels to understand. So really go through these few slides and really make sure you have an understanding of these. So explain, um, having them explain in their own words. Key verbs for this would be describe, differentiate, explain, interpret, or give examples. So not only are they recalling basic information, like you might have a student with really great like photographic memory and they can just see that paragraph and recite to you back exactly what it says. Okay, that's great. That's level 1. So for level 2, show me that you understand that. So take that, tell me in your own words exactly what that means. Describe how you would fit that into something. Differentiate between what you just told me and this. So it's just the next level up. Okay. Level 3, application. So applying. Applying represents the third cognitive level in the domain. And this level involves application of rules, methods, concepts, principles, theory. Um, this level kind of bridges the gap between theoretical knowledge and clinical practice. So we're starting to make those connections at this level. They can take the abstract concepts they've learned in theory and start applying them to direct patient care, and see the relevance in practical situations. So problem solving and connection making, key verbs would be apply. So you have this information, you've learned it, you've restated it for me and given me examples and differentiated. Now apply that to your patient today. Relate that back to last week when we had this patient in clinical. So those are some key verbs for that. The example here relates pain theories to nursing care of patients with chronic pain. Okay, so the next level, analyzing. So that's the 4th level, where the students demonstrate the ability to break down nursing material to its component parts and the relationships between these parts. It's looking at motives, causes, underlying structures, just taking it down another level, just or up another level. So breaking down complex clinical situations and seeing all the different parts that are happening to make that all together, what's happening at the time. Looking at relationships, kind of where concept mapping helps a little bit. Like I have this information, but how's it all interrelated? looking for patterns, seeing consistent themes or patterns and recognizing them, and then being able to articulate that. So key verbs for this level would be analyze, compare and contrast, identify reasons, relate elements. So an example would be analyze needs of patients following a cabbage. Okay, and then the last one, evaluating. That's the 5th level in the cognitive domain, revised taxonomy, where nursing students demonstrate the ability to make clinical judgments based on criteria and standards. So this is critically assessing the information, the methods, and the outcomes correctly, and being able to see all those individual pieces, put them together, analyze what they mean, and make judgments about patient care. So for example, evaluates a nursing research study, quality improvement, stuff like that. Level 6, creating. This represents the highest level of cognitive learning in the revised taxonomy, where they're able to take everything they knew and generate new ideas. So alternative hypotheses, original ideas, key verbs here: construct, create, design, develop, propose. There you go. Okay. So that was the cognitive domain. Moving on to the psychomotor domain. So observation, watching, following, imitating, practicing it, and then mastering it. So those are the psychomotor domain processes for that. So observe, imitate, practice, master it. It involves the development of motor skills, technical skills, technology, and assessment skills. So basic procedures all the way from vital signs up to complex interventions regarding coordinating and timing. Think of taking vital signs versus running a code, everything in between. So those are your psychomotor skills. Okay, and the affective domain, this is the attitudes, morals, ethics, culture, beliefs, values, all of those that are innate in all of us. Same but different, right? We have internalization, organization, valuing, responding, and receiving. So we receive, we're aware, we have attention to our values. We can actively respond and demonstrate commitments to our principles. We prioritize them in our personal system and allow that to guide our professional behavior. So for example, I'm a follower of Jesus, right? So I'm a Christian. I'm a wife, I'm a mom, I'm a nurse, I'm an educator, I'm all these things. And I participate actively in all these areas of my life. I am committed to these areas of my life, but I have a priority system. So God first, family second, everything else under that. Um, and I use that to guide my behavior. Um, I use that to guide even within that hierarchy system that I personally have. Um, I still allow my faith to guide my behavior within my family and within my everything else, within my nursing care and my student relationships and interactions. So it's all kind of like a hierarchy. Hope that makes sense. Okay, and that's it for chapter 1. So just to summarize, the initial assessment process, why it's important, make sure you use your SMART goals, understand the cognitive domains. I think psychomotor domain is pretty self-explanatory. Learn, repeat, master. And the affective domain also pretty simple to understand. However, I think it's important that you sit and make sure that you can differentiate those things in your mind, what your values are, how do your values drive your morals and your ethics, because not only in life, just in normal everyday life, maybe with your relationships or your children or your job, but even when you get into patient care, if you're an educator, what you're going to like your interactions with your students and how you work and design and navigate your classroom, those kind of things. It's really important to understand your own affective domain before you can be in a situation where um, you're called to understand that, but you haven't thought about it beforehand. I don't know if that makes sense, but I know my Christian values dictate my ethics, my cultural sensitivity, my patient care. But I know that because I've been in situations and I've had to sit and think about it consciously, intentionally. And now I'm better prepared when I'm in those situations, how to deal with them, because I already have the framework in my mind of how I'm going to deal with those situations based on my own ethics, my own morals, my own beliefs and values. So just take time to think through that. And it helps you when you're in those situations in the future, be able to navigate them if you're really clear on where you stand. Okay, hope this helps, and I will see you in the next chapter. Bye.